One of the leading public health threats of the 21st century is unfolding, as bacterial infections increasingly begin to evade treatments. This is the escalating threat of bacterial antimicrobial resistance, or AMR, where changes in bacteria cause the antibiotics we depend on to save lives to become less effective. In 2019, this crisis claimed nearly 5 million lives globally, 4.3 million of which occurring in low and middle-income countries, with 1.27 million directly attributed to resistant bacterial infections. In OECD countries, 1 in 5 bacterial infections is resistant to antibiotics, causing around 79,000 deaths annually. By 2050, AMR could cause up to 10 million deaths globally per year, matching the 2020 death toll from cancer. These numbers are more than just statistics. They represent real people and families. The primary challenge is dealing with resistant strains of bacteria that complicate treatments for severe conditions, especially in healthcare settings where over 60% of AMR-related deaths occur. Patients with resistant bacterial infections face complications and longer hospital stays, impacting health systems and increasing the demand on resources. Climate change further exacerbates this issue, altering infection patterns and worsening the spread of drug-resistant bacteria. Poor waste management and water treatment, as well as the extensive use of antibiotics in agriculture, further facilitate the transmission of these microbes into our shared environment. Efforts have been made in various regions to reduce the use of critical antibiotics in food-producing animals by significant percentages over recent years. However, most antibiotics are consumed by people, and it's this human use that drives bacterial AMR. Effective antimicrobials are crucial for food security, animal welfare, and our economy. Without action, the economic impact of treating resistant infections could rival the devastation of a COVID-19 pandemic every 5 years. The One Health approach is essential in tackling AMR. This strategy acknowledges the close links between human, animal, and environmental health, and highlights how resistance spreads through direct contact and environmental channels. Globally, significant investments have been made in One Health surveillance, aiming to monitor and control the spread of AMR through various initiatives. However, more needs to be done. We need to reduce antibiotic use across all sectors, improve waste management, and invest in innovative solutions to curb resistance. By staying informed and working collaboratively, we can protect global health and ensure a safer future for all.